Can you see the slides, Tessa? They are being shared.
No, I can't see the slides. Can anybody else see them?
Yeah, I can.
No.
Yes.
Might have to spotlight me as well if we've already got a couple of people spotlighted. I don't know if that will.
So shall we start anyway while we try and fix the slide issue? Or do you want to get that sorted, Jordan?
Yeah, so if someone just spotlights me the same way that the
Yeah, so Jordan, I've just spotlighted you and Helen should be spotlighted. So Tessa, can you see Jordan's screen?
No.
On your display, you know, if you click on the three dots, are you on sort of together mode, gallery, large gallery, kind of look at your specific settings? If it's just
I'm on gallery.
That's strange.
So some people can see the slides and the screen.
Yeah, I can see them fine as well. Shall we try switching it? So is Reese around? Reese, can you share yours if possible?
So Mark can't see them. So some people can and some people can't. I might try leaving and coming back in and seeing if that fixes it for me.
And just so you know, I've lost Beth as a spotlight, my other colleague, but just to let you know, at some point she will need spotlighting.
I can see the slides now and I can see Beth.
Yeah, it says I'm no longer spotlighted.
You are now, Beth.
Okay, thank you.
So welcome everybody to our webinar on the community health profiles. I'm sorry that we're having a few technical glitches to start with. Just want to check that everybody can see the slides now. Can you put in the chat if you can't see the slides? I think. So most people seem to see them. I found that leaving and coming back in was what fixed me. I'm seeing some thumbs up. So I'm going to proceed because I'm concerned about the time. So welcome everybody. That's right, Mark, it is. Yes. Good. Excellent. So welcome everybody. My name's Tessa Lindfield and I'm an Assistant Director in Public Health in the Birmingham City Council Public Health team. And welcome to our webinar this morning where we're talking about our community health profile for the deaf community. So we are going to be, as you can see, using a British Sign Language interpreter for this session today. I'm hoping that everybody can see her there. If you have a question, then please feel free to put it into the chat and we'll have an opportunity to pick those questions up later. If we don't get to all the questions, we'll produce answers after the webinar today. So I'm going to kick us off, and the first thing I'm going to do is introduce our Cabinet Member for Public Health, Councillor Mariam Khan, who's going to welcome everybody to the meeting today.
Thank you, Tessa, and good morning, everyone. As Tessa has said, my name is Mariam Khan. I'm the Cabinet Member for Health and Social Care at Birmingham City Council, and I'm delighted to see the launch of our community health profiles and so pleased to be welcoming you all. I'm proud of how diverse Birmingham is and of how welcoming we are to people who choose to make this city their home. However, we know that not all of us experience the same levels of good health and well-being as each other, and that there are real differences between communities. In the council, we take this seriously and we see tackling these unfair differences in health as a core component of the work that we do. The community health profiles have identified and summarised the physical health, mental health, lifestyle, behavioural and wider determinants of health-related issues affecting communities, both locally and nationally. The findings from these key public health documents will shape how we address, protect and prevent health inequalities in our city. We've always struggled with understanding the detail of some of these inequalities, and this is where our community health profiles come in. The Public Health Communities team have, in partnership, developed a series of evidence summaries that focus on helping improve our collective understanding of our diverse communities, the health and wellbeing challenges and key inequalities that they face. I hope that you find this session useful. We've got the opportunity here today to share our approach and findings with you, and also for us to be able to discuss in detail a bit more about what these health profiles have created for us in terms of a set of key documents for us to be able to refer to and reflect on when it comes to improving health inequalities across the city. Afterwards, we'll also look towards how we can work together, not only for our respective communities, but for Birmingham as a whole. Thank you ever so much, and I'm sure that this launch event for the deaf and hearing loss community will be as good as the other health profile launches that have already been taking place, and I'm really pleased actually to be here in person for this one, as this is the first one that I've been able to attend, and I'm hoping to be at it for as long as possible. Thank you again, Tessa, and thanks to all the teams that have made this possible and made it possible for us to be at this stage. Thank you once again. I'll hand back to Tessa.
Thank you, Councillor Khan. It's great to have you with us today. Let's move on to the next slide. So we'll start with a little bit of housekeeping. I think it would be helpful if people can stay muted to keep the background noise down. I think everybody is, because I can't hear any background noise. And if people are having trouble with bandwidth, we found it helpful to switch off VPNs if they're getting in the way. It would be great if people can introduce themselves on the chat. So put your name, your job title, the organisation that you're representing today in the chat so that we all know who's here. And again, if you've got any questions, feel free to pop them into the chat. This webinar is being recorded and it will be available on our website as part of the suite of tools and products that are available around the community health profile. So you'll be able to listen in if you miss any of it today. Let's move on to the next slide. We're going to be using Menti today. Mentimeter is a tool that we use for some interactive work during the webinar. So if you don't have it, you can use the QR code to download it onto your phone, or you can search for it on menti.com. You need to open the app and use the code there to make sure that you get into the right presentation for this particular webinar. And the code today is 43635812. So yes, so we'll be using Menti. So not quite yet, but you've got a few minutes to get it uploaded onto your phone. Let's move on to the next slide. So the community health profiles are part of a series of public health evidence reports that we've been working on in the Public Health Division. One of the key roles of public health is to bring together information on the population of Birmingham and the communities within that population. And one of the things that we're particularly interested in is looking for any differences, inequalities in health between different communities. Now, some of these evidence reports we have to produce by law, and there are two on the slide here. So we have to do a joint strategic needs assessment, which is a summary of the health and wellbeing status of people in Birmingham and the issues that affect their health. And we refresh that every year, and that's published on our website. And then the council also has a duty to publish an independent report of the Director of Public Health, so Dr. Justin Varney, and he produces an independent report each year on a particular issue that he's concerned about affecting health and wellbeing of people in Birmingham. Next slide, please. So to supplement those reports that we have to do, we have a series of reports that we've chosen to do, and you'll see those summarised on this slide. So we have a series of deep dive needs assessments, which are particularly focused on a particular community, and they make recommendations for action on meeting the needs of that community. And we also have a couple of topic-based commissions that we're involved in as well. But today we're going to talk about the community health profiles. And these are collations of published information. So we've done or commissioned a desktop analysis of the evidence that's out there in the published literature, the peer-reviewed literature, and also in the grey literature, and brought that together with population survey data to produce a snapshot of the health and well-being of a particular population, and in particular the health inequalities affecting that population. So move on to the next slide. And everything we do around health and wellbeing in Birmingham is governed by our health and wellbeing strategy. And the aim of the strategy is for Birmingham to become a bolder, healthier city where everybody can enjoy a healthy, happy life. And the community health profiles help us understand the gaps in achieving that ambition between different communities, because they describe the health inequalities of a specific community, and that community might be bonded by a sense of identity or joint interests or a joint experience. And the profiles set out the differences in need, and this is the idea is that this helps people make decisions about interventions or programs or services that might address some of those health inequalities. And we believe that, you know, you make better decisions if you've got facts at your disposal. And the idea of the community health profiles is that it brings together all that information that's out there in one place so that people can access the facts around a population more easily. We want to make the community health profiles available to anyone who will find them useful. So they'll be published on the council's website, and the idea is that they're there for anybody to access and anyone to use. Now, as soon as you publish information, of course, it goes out of date the minute you put it on paper. So we're keeping a live eye to new information coming out that might be of use to our profiles, and we will aim to refresh them every 5 to 8 years. But if something comes out in the meantime that we think is particularly pertinent to one of our profiles, of course, we'll make an effort to include that. So you'll be aware that the census data is being published this year and next year from the 2021 census. So there may be some updates that are needed in the profiles before then. The next slide. This slide gives the summary of the complete evidence programme. So the community health profiles are in the pink box there, and you'll see the deaf and hearing loss profile highlighted in bold there. That's the profile we're talking about today, amongst the other profiles that we've got that have either been published or about to be published. And you'll see how they fit in then with the topics around the deep dive reports and the commission, so the Poverty Truth Commission and the Birmingham and Lewisham African and Caribbean Health Inequalities Review. The next slide. So the idea that the community health profiles is that they don't just look at the physical health needs of a particular community, but they also include information around mental health and healthy behaviours, and also those wider determinants of health, the social and economic factors that we know are really important in influencing people's opportunities to be healthy. And we want to, the idea is that we collect that information together and present it under the priority areas in the health and wellbeing strategy, creating a bolder, healthier city. And this webinar is the start of the engagement process. So the idea is that we've produced the document and the products that go around the document, and we use those then to go and have conversations with the communities about the evidence found so that we can highlight the opportunities that are available in Birmingham to address some of those inequalities that are apparent in the profile. And again, this webinar is part of the beginning of a promotion. So we really want to make sure that everyone knows that these are available so that they can use them. So this is the first step for us in promoting the fact that community health profiles have been published. The next step. So this slide gives us the health and wellbeing themes, and you'll see that we go from the cradle to the grave, looking at a life course approach throughout life. Right the way through from best start in life through to ageing and dying well. We've also got sections on closing the gaps, opportunities to close the gaps, inequalities, and also looking at the green and sustainable future, because we know that the environmental threat is a big determinant of health for the long term. Really important for us to consider, and the legacy of COVID-19, which shone such a harsh spotlight on our communities and the differential impacts that COVID has had between different communities. So it's a bit about mitigating the legacy of COVID. Next slide. So the methodology of the community health profiles is that this is a full literature review has been conducted of academic resources. So we want the information in the profiles to be reliable information. So we've gone to peer-reviewed literature, and then we've also looked at the grey literature, so literature that's published by community organisations or by government, and then also by communities that serve the deaf community. And then we've also looked at health and wellbeing indicators and data that will also add value to the community health profile. And we've looked, where we're looking at health inequalities, it's often useful to have a comparison group. So to look at the data of the population that is of interest in the community health profile and comparing it with other populations. So in this profile, there's quite a lot of comparison to the hearing population in the UK. So the community health profiles can't be everything to everybody because there's only so much information out there. And the idea of the profiles, they bring together the information available in one place. So it's not new information. We haven't gone out and commissioned brand new research. It's a collection of the information already out there. We know that the 2011 census was rather limited in the information it collected on disability, so that's limited the scope of the profile. And we also know that that data is quite old now, so it's likely to have changed. So we need to think about that when we're interpreting the information in the profile. There's also limitations about the way people have been included or excluded in the studies that were used as part of the collection of the evidence. So, for example, people who are born deaf or with hearing loss may have a different lived experience to people who've acquired hearing loss at some point in their life. And sometimes studies don't separate those two groups out. So we need to be aware of those limitations within the profiles as we're reading them. So the community health profiles at the moment are quite a long written documents. So to accompany the written report, there's also a set of slides, of PowerPoint slides, which we really want people to use and access. They're all published on the Birmingham City Council Communities pages. There's also a highlights video, and this webinar, as we said, will be recorded and also available online. Okay, so to step us through some of the key findings in the deaf and hearing loss profile, I'm going to hand over to my colleague from the communities team, Ricky Bandal. Thanks, Ricky.
Thank you, Tessa, for the introduction, and thank you for the intro. Good morning, everybody. I'm going to be going through some of the details in the profiles over the next 15 minutes. It's really important that I kind of highlight at this bit, and we've done it with all the profiles that we've mentioned, that some of the information within the presentation itself could have some triggering effects. It does cover very sensitive topics such as mental health, anxiety, suicide as well. So we do have some support group, some numbers and contacts within the chat facility here, and our staff are available just in case if any further information or help is required. With that being said, I'm going to go into the slide. So I will be saying Jordan, next slide, quite often, and that is just the indication for the next slide. Okay, so I think what we need to kind of define within this, so this profile that we're talking about today was done internally within my team, around the definitions of hearing loss. So people without hearing loss can hear noises between 0 and 140 decibels. The next two statements are taken from two studies, one which was the British Society of Audiology, and the other one which was the NCBI around hearing loss and deafness. And their definition was hearing loss can range from mild 20 to 40 decibels, where the person might find it difficult to follow speech in noisy situations, to profound above 95 decibels. And the final part was a loss of 35 decibels is considered disabling hearing loss. This figure is different around the world. Very important on the last bit, because some of the information that we have, if it's Birmingham based, we will use. If it's UK, we will identify. But if there isn't anything, then we will go across the world. It's also very important to notify that it's not necessarily just the information that we find which is important, but also identifying the gaps, which is crucial, because that is the area of work that we would like to engage in, or apply kind of pressure for monitoring organisations to look at this in greater depth. We are this project has never been done before across all the profiles that we've done, so it is a learning process, and we will be evolving our techniques as we move forward. Okay, thanks, Jordan. So the first statement, which is around the UK has about 12 million people living with mild and hearing loss, and that's 1.2 million adults have hearing loss 65 decibels or greater. That's actually coming from the Office of National Statistics. I'm just conscious that Helen's just frozen on the screen for a second. Okay, Beth is there. Okay, thank you, Beth. And the next two was which looks at the sort of our future commissioning, for example, is that by 2035 there could be up to 14.2 million adults in the UK who have some hearing loss. This statistics were identified in two studies, one which is by Hearing Link around facts about deafness and hearing loss in 2021, and the other one was again from the RNID facts and figures of 2021, which are available. It's important to stress that this presentation will be available online with our references as well. The bigger report in itself is a document looking at about approximately 100 pages. So what we're doing in this is we simplifying it as best we can. There are some infographics that accompany this as well. Thanks, Jordan. So how does it affect? What's the picture in Birmingham in itself? So the picture on the right hand side, you'll see a graph there, which was taken by Oxford Brookes University in 2020, and that looking at the estimates of people of having hearing loss in Birmingham. So in Birmingham in 2020, there were 152,158 people with mild hearing loss or greater. Around 8,260 people are registered as deaf or hard of hearing in Birmingham, and Birmingham remains the largest deaf community compared to other metropolitan districts in the country. In general, the health inequality that's been identified within the report focused on 7 areas. One is there's higher rates of birth complications. Deaf children are less school ready and have lower educational attainment. High amounts of mental illness within the community, and leading to difficulties accessing services. Increased risk of domestic violence in deaf women. There are limited employment opportunities, which is really crucial because it's one of the single biggest factors of improving life expectancy is to have a job. High rates of high blood sugar, and you're twice as likely to have undiagnosed diabetes. And there's also an increased risk of falls in older people. Just want to point out in terms of some of the terminology that's been used also can be quite sensitive, and this is just being reflected in terms of the reports and journals that we have accessed. Jordan?
Did you get any answer?
No.
Did you get any answer?
So this is another one. No, we've got
Hang on, I just got to put somebody on death. Okay, spare me. Sorry. Thank you very much. Okay, so this slide actually looks at contributing factors of getting the best start in life. So as Tessa explained earlier, the profile splits into 10 sections which follow the health and wellbeing strategy. In conclusion, the factors are around poor communication between providers and patients, poor patient adherence to treatment, lack of awareness of healthy behaviours, and communication issues because of the lack of BSL. What's been also highlighted is that in 3 reports that had come out, one of them of which was a Birmingham City Council report around seldom conversations around pregnancy and getting the best start in life, especially for maternal health, was deaf and hard of hearing women have a higher risk of pregnancy and birth complications such as gestational diabetes and pregnancy-related blood pressure disorders. Jordan? again, continued. There's two areas that we've focused in on here. One, it was taken from the National Deaf Children's Society and a called the Right to Start, and that identified deaf children are less likely to achieve communication and language early goals of listening and attention, and those were ranging from 50% to understanding of the content, 46, and then speech difficulties, which was around 42% of those who conducted the survey. There was also another survey that had been done by again by the National Deaf Children's Society, which highlighted that deaf pupils are also less likely to achieve 5 GCSEs or similar compared to the general population, which is the 73% versus 88%. Jordan, thank you, Jordan. Now, really, within mental health and well-being factors, there were the reasoning that had been concluded and summarised was around being left out of social situation, which is increasing around social isolation and loneliness, less education and employment opportunities, lack of awareness of deaf culture, and finally poor care and decline in health and well-being. Identified that the rates of depression are double in the deaf community at 24% compared to the general population. Now, this was taken from an NHS Joint Strategic Needs Assessment in 2018, which identified this, and it was also backed up by another study by the BMJ, which is the British Medical Journal, and that was looking at the current health of signing deaf community in the UK compared to the general population. Slide, please. This is becoming more and more topical, especially the current climate. Identified the obesity within a study that had been done in 2013, which looked at the analysis of current health and access to healthcare of deaf people in the UK, and it identified that 72% of deaf men and 71% of women were classed as overweight or obese, and this was compared to the general population of 65% and 58% of women. It needs to be said at this point that there is a limited data to understand the knowledge of healthy eating and portions across the deaf and hearing loss communities. So again, as I mentioned at the beginning of the presentation, it's not necessarily about some of the data that's been identified. It's also about the gaps and also for us to apply that pressure on. Next one, please. Thank you. So being physically active is also really crucial, especially based on the information that had already been supplied. So a report that was done in 2018, which was the Activity Alliance by UK Deaf Sport, which supported Deaf Awareness Week, identified that 57% of deaf or hard of hearing people do less than 30 minutes of exercise each week, compared to the 21% of non-disabled people, and that is a recommendation of 150 minutes. Some of the statistics you can see on the left-hand side, but in overall, some of the barriers that have been identified were around concerns about the lack of fitness, the cost of partaking in sports, lack of confidence, and barriers to communicating. Now, in this study, we talked about employment and a little bit earlier on, and one of the standout sort of studies that was done was a report that was done by the RNID around hidden disadvantage and concentrating on why people with hearing loss are still losing at work. And that identified that only 46% of working age disabled people are in work. That led on to 8 out of 10 people with hearing loss reported that the attitude of employers is a large barrier of gaining employment. So the next set of slides are sort of late additions into the strategy. So I'll be putting a few of them together and then the last two were done regarding COVID. I won't go into a little bit of. I will only go into a little bit of depth because the infographics supply that information. So this was around screening, again from that same report that I mentioned in the previous slide around the from the RNID around hidden disadvantage, and that was saying that 35% of people with deaf and hearing loss have lower cancer screening attendance in single people than in married people that have been identified. Also, again, in a similar report that was done from it was a government report around deafness and HIV and stroke AIDS, which was a systematic review of literature, identified that the deaf community experiences higher rates of unplanned pregnancy and STIs compared to the rest of the population. Another section here, which is summarised by the 4 areas identified at the bottom of the slide, which was looking at some of the barriers and some of the reasonings, was that of aging and dying well. There's an increased risk of dementia, more likely to report falls, high levels of cholesterol in one third of deaf people, and 47% of the community have hypertension. So hearing loss is a leading cause of years lived with disability for those over the age of 70. There is you're twice the risk of developing dementia with those with mild hearing loss, which is 5 times the risk for those with severe hearing loss. And that was taken from a report done in 2021 around hearing loss and dementia and how are they linked, and that was by the RNID. Now, important that we talked about the gaps, which I said earlier on, and it's particularly around the gaps in the healthcare service. So this was taken from a study in 2020, which identified by Paganattoni, looking at regional patterns and trends of hearing loss in England, and it identified that 80% of deaf people want to speak with a doctor in BSL only, and only 30% actually managed to access that service. 24.6% of deaf patients definitively have trust, confidence in their doctor, which identifies itself compared to the 67% of the population. And 18.3% said they had no confidence at all. Sorry, I can't see the chat, but we'll pick it up with the questions a little bit later on. Looking at this was a new section that we did put in, which was around green and sustainable future, to identify that there was very limited detailed data around this whole section. In one report, which was done for Deaf Ambition for 2021, the research suggested that as electric vehicles are quieter, there are some safety issues around with those with hearing loss. And in 2019, another report, which was taken from the Global Grants Fund, was looking at the environmental justice movement, identified that about saying that people who are deaf may not have equal access to information on climate-related issues. Again, looking at the current sort of news cycle, it's going to become, it is another gap that needs to be closed. So this area around the mitigating effects of COVID-19 is something that's most likely to have more data on it post-pandemic. But in conclusion, this was done by a report by Sign Health, and the results was from a survey looking at the pandemic in 2021. It concluded that 1 in 3 reported that the pandemic had a major impact on their mental health, with most experiencing anxiety at 61%, stress and worry at 60%, and depression at 35%. I'm conscious of giving a lot of information there in a very short space of time. So what we've managed to do is to conclude this into 4 infographics, looking at each of the strands that had been identified. Jordan? So one is looking at from an international context to a national and then an overview. What I will say is that it's really important that these are headline information and headline data that you can use in terms of whatever work that you choose to do. But the real context of this is, and the gold is in the bigger report as well, which you can access, which is available online. Jordan? Here we start to go into the themes of the actual health and well-being strategy. So mental health and wellness, healthy and affordable food, and getting the best out of life. We then progress on to working and learning well, protect and detect, and active at every age and ability. And then finally, we're going towards the closing the gaps, green sustainable future, and aging and dying well. So if we look at, for example, one area around cardiovascular disease, that 32% of the deaf population have that compared to the general 50% of the general population. And then looking at cancer screening as well also. So I'm just going to move on to the next slide in terms of what the next steps are, and then you'll have an opportunity to kind of ask questions at this point, and then as we go into the Menti. The next steps, what we're looking to do is that we've already got 16 of these profiles. We're looking to do another 12 in the next from now until the next in 12 months time. The engagement opportunities that we have here now is to we've gone out to tender with communities that have been identified with the profiles. What we're able to do then is some partners who we've already have been given, we've already named, some partners that are still in that process of tendering. And what we want to do is to work with that organisation to identify a few of the inequalities that we've got here, because these inequalities have been decades as a result of decades of work, so to speak. We know we're not going to change this overnight, but what we're trying to do is to start on the right foot of working with the community to see if there's things that we're able to do, and also empower those communities to look at this data. Not just people who we've selected, or anybody can look at this data, apply for bids or tenders wherever they are, because there's a document that they're able to kind of take little parts from and decide which part of the sea they want to boil first. But we're working with we're going to work with a provider, see what we can do in ourselves, share this not only within our public health team but across Birmingham City Council, and which should have an influence on future commissioning as well, and most importantly, future decision making. Tessa, I'm going to bring you in at that point. Is there any questions that anybody want to raise at here before we go into Menti?
We've had a question in the chat already about looking whether there's any specific data on the prevalence of diabetes for the sight loss community, which we talked about earlier on today, and also the deaf community. And I don't think we have that information at a granular level for Birmingham, but there's certainly some work we could do to apply the percentages that we've seen in the literature to our population in Birmingham to have an idea, and also some opportunities, I think, around data linkage coming up that might help us get a bit more information on that to help people for designing services moving forward. Are there any other questions that anyone's got that they want to pop in the chat? We can pick them up now or at the end, so feel free. Otherwise, I think we'll move on to Menti while people are thinking. I can't see any hands up or anything popping up in the chat.
What I will add on to that, Tessa, is that there are sections within the actual profile in itself which go into bigger depths and identify the limitations within diabetes as well.
Yeah. Yep. That's really great, isn't it? That already the information in the profiles is sparking ideas about what we can do with it to help make things better for people and change the way we deliver our services, which is exactly the idea behind them. So it's great to see. Okay, so now it's time for you guys to do some work. So we're going to use Menti, which is this app that we talked about earlier on. So if you go to Menti on your phones, If you haven't got it loaded, you can use the QR code or go to menti.com or search for Menti in your whatever your app store is, and put the code in. And the code's 43635812. And then we'll get the first question pop up on your phone and we'll put it up on the screen here, and we should be able to see the results live as people enter them. Right, so the first question is, how do you feel today? So you can slide the slidey thing on the scale to see how you feel, as to whether you're feeling sort of anxious or frustrated or understanding, low mood, energized. How are you feeling? Let's see how our group's feeling today. Oh, not bad, 7.6. That's pretty good, better than it was first thing. Everyone was having a bit of a slump first thing this morning, but it looks like it's improving a bit. So we can see at the bottom right-hand corner of the screen how many people are responding on the Menti. So we've had 13 responses, which isn't bad. Feel free. And if you want to put a comment in, you can also send a comment. So great. Okay, so the next questions, we're going to start asking you some information about yourselves. If you don't want to tell us the answers, the questions that we're answering, that's perfectly fine. If you do feel comfortable sharing, it'd be great to know. So let's move on to the next one. So I want to know how old you are. People are prepared to tell us. We've got quite a nice range, haven't we, here, of kind of working age adult range. That's good. Nice spread. That's great. This really helps us for our future engagement to see whether, if there are groups that we're missing, or groups that, you know, we're only talking to, I don't know, middle-aged women or something. So it's really important that we see this. Thank you. Okay, let's move on to the next one. So how would you, and if you want to skip ahead on this, if you're running out of time and need to zoom off to another meeting, you can zoom ahead on the questions. How would you define your ethnicity? And again, if you don't want to tell us, that's absolutely fine. It's no pressure. People have been really open. Thank you. That's great. Okay, and how would you describe your religion? So we've got a few clusters there around Christian group and people with no religion. That's great. Thank you for sharing. Let's move on to the next one. And do you consider yourself to have a disability? And most of the people on the webinar don't consider themselves to have a disability today. That's great. And the next one. We want to find out where you're listening from. So what's the first part of your postcode? So those results don't come up, but we'll just give people a little bit of time. You can see the numbers ticking up slowly to how many people have responded. Okay, let's move on. So now we want to pick your brains a bit. How would you or your organisation cascade this information into the deaf and hard of hearing community and with key stakeholders? So we're looking for ideas on how you would cascade this information. So we've got a nice range here. Feel free to put more than one comment in if you've got more than one idea. So we've got ideas about management need to read the profiles, talk about using them for commissioning and for community events through social media and with community champions. Some really good ideas coming up here. So any other ideas people have got about how you plan to cascade this information through to the deaf and hard of hearing community and with key stakeholders? There's some great ideas there. Thank you. That's brilliant. Shall we move on? The slightly different question. What opportunities do you have to embed the key findings in your line of work? So in your particular line of work, what opportunities do you have to embed the key findings? So we've got a great variety coming in here, which is lovely. So we've got comments about driving lessons and employment, about homelessness, cycling, social prescribing, as well as working through partnerships and corporate comms. Okay, let's move on. Okay, so now you get to choose which you think is the most important issue, which is the most important health inequality for the deaf and hard of hearing community to focus on. Is it the blue box, which is higher rates of birth complications for deaf mothers, the fact that deaf children may be less ready to go to school and have lower educational attainment? Is it around the mental illness challenges within the community and difficulty accessing mental health services? Or is it around the undiagnosed diabetes or falls in older people? So as people vote for their most important issue, then the bars will jump around. And we'll see what people think are the most important issues. It's great. So we've pretty much, oh, they're moving around again. Last minute switch. So we have, oh, and again. Okay, so I think the school readiness just about topped the list there, with second around birth complications, mental illness, diabetes and falls. Yeah, so a clear top three there. It's really useful to know. Let's move on. So what should future engagement look like for this deaf and hearing loss profile? So we think about the profile, what should future engagement look like? Some people got in early there about with some messages which are really helpful. Yep. Someone said there, this is a start. Absolutely, it's the start of a journey, this, isn't it? It's not the end by any means. Lots of work about partnership there. That's great, thank you. Let's move on. And how will we measure the success of this profile? How will we know if it's been useful or not? There's some themes there around real change in terms of outcomes and a lessening of the inequalities, but also looking at service provision and awareness of the needs of the community as well. It's great, thank you. So, and are there any other formats that we need to look at to improve the accessibility of the information in the community health profile? So we've got our sign language interpreters here today, which will be on the video. We've got the infographics in the slide deck, and we've got the the actual written documents as well on the website. So is there anything else that we need to do? Any other formats or ideas that people have that we could use to improve accessibility? Yeah, so some ideas there, and picking up the fact that if you have a hearing loss or a deaf, then it might not be your only disability, or you might use a different language. Absolutely, really important. Right, thank you. Okay, so now we've come to the end of the session. How are you feeling? So I think we were 7.6, weren't we, at the beginning of the Menti bit of our workshop. How are we feeling now? Well, we're at 8. Oh, it's slipping a bit. 8.4. Okay, well, it's still better than it was when we started the Menti session. So hopefully this has been a kind of positive element of the day. And it's certainly better than the scores we had right at the beginning. For our Monday morning score, I think was 5.6. So we're definitely getting better as the day goes on. So I'm glad that it's been of some use. That's great. Thank you. Okay, so that's the end of our Menti session. And you'll see here that we've got some other, if you're interested in any of the other community health profiles, they will all be uploaded on the website soon. So we've done the sessions already on the Somalian, Kenyan, and Nigerian profiles, the lesbian and trans profiles, the sight loss profile, and of course this one. And then tomorrow there's another webinar about the Caribbean and Commonwealth community health profile. So please feel free to check those out on our website. Okay, and then if there's no other questions that are popping up in the chat, which I can't see, then it's up to me to say a big thank you to our presenters. So thank you, Ricky, for presenting. Thank you to Helen and Beth, our sign language interpreters, who've done a grand job. Thank you. And thank you very much to everyone who's joined the webinar today. It's been really great having you here, and we're really looking forward to continuing to work together on this to address the inequalities that we see in this community. So thank you very much for joining, and we'll finish the meeting there. Thank you. Bye now.